Hey guys, so I'm Dr. Nicole Peoples, and welcome to How to Become the CEO of Your Health and Hormones. In this masterclass, I'm going to give you the exact steps that you're going to need to take control of your health, feel your best, look your best, even as you age. So let's jump right in because I have a lot of stuff to cover. So, small introduction. I'm Dr. Nicole Peoples. I'm a board certified physician in internal medicine, but I specialize in a form of medicine called functional medicine, which is basically root cause medicine. If you don't know what that is, don't worry, I'm going to explain it to you as we go through. But I really focus on helping women, and particularly women of color, take control of their health and get to the root causes of their symptoms, and doing that through recognition and balancing of hormones and so much more. And I use all of my experiences, not just as a internal medicine physician, and not just as a functional medicine physician, but as a woman, as a Black woman, as a mother, as a married woman, a child of aging and elderly parents. So I use all of that to inform me on how I approach health and wellness and how I do use that with my patients. So we'll talk about that as we go through. So what does it actually mean to be the CEO of your health and hormones? Well, when you think about what a CEO does, they, are broadly over the functioning of their corporation. And here's the secret. You are the expert of your health. By default, you are the best fit person to be the CEO, the controller, the person who makes all of the decisions, right? You are not an employee of your body, you are the CEO. And when you are thinking about your health and how you can manage your health, you have to think about it the same way that a CEO would, right? So you want to assess the current situation, and I equate that to understanding how you feel, knowing what's going on in your body, having some insight into what's happening and being able to acknowledge that. And then the next thing, are there any problems, right? So you've got to know whether or not what you're experiencing is normal or if it's not normal, right? And if it's not normal, assess the risk. What is the potential impact of this problem that you have now identified? And then the next step is figuring out why the problem developed in the first place. It's not just fixing the problem, it's figuring out why the problem even exists so that you can prevent it from ever happening again, and then developing a strategy around that. So that's what we're going to do during our time together. And I'm hoping that by the end of this, you will have the tools to be able to become the CEO of your health and hormones. So we're going to start with assessing your current standing, right? So how do you feel? This is a really simple question, but sometimes we don't take the time to ask ourselves this, right? So not only how do you feel, but how do you feel in relation to how you've always felt or how you felt in the past, right? So are you more tired or are you feeling energetic? Are you frustrated or are you purpose driven, right? There's so much that happens in the course of our lives as people that we can shift the way that we feel, but being able to identify where are we right now, right? How are we feeling right now? And how that fits into the grand scheme of my health and my hormones, which we'll talk about as we go deeper. But it's not just how you feel, it's also, do you have any chronic conditions? Do you have any health issues, right? That's also going to be informative, right? Because your symptoms are really a manifestation of something going on deeper. And if you have a diagnosis, that also lets you know that something might be awry. So then the next thing is, how are your hormones? And this is really important, particularly as women, because as a physician, I have seen that hormones are just ignored. We just don't give enough attention to it, right? And I'm going to spend a little bit of time talking about this, but really understanding your hormones and understanding what your hormones influence, right? So if you look at this list, you don't know how many people, and maybe even as you're sitting there thinking, oh, these things are normal. You have no idea how many of my patients come to me and they say, yeah, I've got heavy periods and, they last 7 days and I'm going through a pad every 2 or 3 hours. And they think it's normal because we don't talk about it enough to know what is normal and what's not normal. Or people who are experiencing fatigue and they're just saying, oh, I'm just getting older, right? And they just expect that that's just a normal part of aging, or that I have no sex drive, but that's just normal, right? So it's important that you understand that these are all things that are influenced by your hormones. And some of it might, some of it might be, expected, and we'll talk about that. But some of it, when it gets to be outside of the realm of our control, then there might be something going on that we can fix, that we can improve upon, and that is really the goal. So understanding what's normal and what isn't is super important. So here's something that I love to talk about because, again, as women, we have a lifespan that is ever changing, right? Our teens are different than our 20s. Our 20s are different than our 30s. Our 30s are different than our 40s and our 50s and our 60s. And not just by happenstance, by science. They change because our biology changes, because our hormones change. And if you as an individual have not taken a moment to really recognize how these hormonal fluctuations impact how you feel, then you're going to miss a lot of what you have control over. So let me make this a little bit more granular for you. So this is just a rough image, and let me zoom in for you guys so you can see it, of what's happening in a woman's hormones over her aging process. And the thing I want to draw your attention to is, in your teens, really your hormones are actually rising, but then they start to plateau out. And, your estrogen and your progesterone, right now we're just specifically talking about our sex hormones, are at their highest and their most stable usually in our 20s for most women, not for all. And so if you're in your 20s and you're not feeling high energy and you're not feeling stable, then really there might be an issue there. But then the other thing I want to show is that in your 30s and 40s, your hormones are decreasing, but they're also fluctuating. And it's this fluctuation in our hormones that causes a lot of the symptoms that we might be experiencing. And we're not recognizing some of those symptoms as being expected. And some of those symptoms may be out of control, but we don't know the difference. We don't know the difference oftentimes of what could be a normal fluctuation in our hormones versus what might be a problematic fluctuation in our hormones. And part of the reason we don't know this, I think, and my theory is that if you go to your doctor, if you're talking to other women, there are 3 phases of a woman's life that we actually focus on. And typically it's, puberty, and then pregnancy, and then menopause, right? But there's so much happening in between that with our hormones that if we're not focusing on it, then we're going to miss some big, big, big things. So what to expect when you aren't expecting, right? So what's happening in your body when you're not trying to get pregnant? Particularly for women between their 20s and their 40s, everything is either you're trying to get pregnant or you're not, right? So you go to the doctor, you have an issue with your cycles, you're having an issue with your mood, you're having an issue with your symptoms, whatever they may be, your weight. And it's like, we can give you a birth control pill, we can give you a medicine for depression, we can give you a medicine for anxiety, we can give you a medicine for sleep, right? Without really saying, okay, maybe all of these symptoms are related to the fact that there's something else going on. And so we have to sort of start to take a moment, take a breather, and understand what is happening when we're having these fluctuations in our hormones, as you guys saw on the previous slide, right? So it's absolutely normal for your moods to shift. When your estrogen levels are higher versus your estrogen levels being lower, your moods are going to shift. Understanding that if you are a cycling woman, that your moods and your energy and your ability to manage stress may fluctuate with where you are in your cycle. So if you haven't taken the time to chart your cycle and see how you feel, like get a rhythm of looking at your cycle for over 3 or 4 months to kind of figure out what's normal for you and what's not, then it's going to be hard for you to know when things are not going the right way. But other things happen when our hormones are fluctuating. Our sleep is changing. Our fitness and our strength, the way we exercise is going to change. And some of the stuff might be very, very normal, right? It just means that once we are aware of it, then we can make adjustments, right? So I'm not saying that, yes, your sex drive may in fact go down or your metabolism may go down, but knowing that, hey, okay, so this amount of change is normal, and then knowing what to then do about it is really where the money is. That is where the CEO behavior kicks in, because it's now saying, okay, yes, this is normal, but I actually know how to address this, and I know how to pull us back into normalcy for my age, for my health condition, for my health status, right? Again, we'll talk about all of this, but I just want you to start thinking about these things. All of these things might change normally, right? You can expect them to happen, and then we will talk about what you do when they start to happen. So, to understand that, you have to start thinking about what actually affects your hormones, right? So in this image, I'm showing you all of the factors that actually will influence your hormones. So your sleep, toxins you're exposed to, your ability to manage stress, overworking, right? Your nervous system or your gut, your exposure to viruses, community engagement, or relationships, the foods that you eat, and what's going on with your actual ovaries, right? Like, do you still have your ovaries? Were they removed? Do you still have your uterus? Was that removed? So all of these things actually affect your hormones, and if you're not focusing, if you're not doing the things to support your hormones using all of these tools that you have here, then we need to ramp up your CEO skills. So, what are symptoms of hormone imbalance? So, we talked about that a lot of these changes can be normal, but when they veer off into being very problematic, right? So, of course, you can have fluctuations in your mood, but if you're consistently irritable, if you have high anxiety or you're depressed, well, then that might be a problem. Yes, your metabolism may go down as you get older, but if you start to lose control of your weight and you continue to gain weight without any form of being able to manage that, then that's a problem. If you're developing fibroids or endometriosis, right? So you may have some discomfort with your period, some pressure, but you really shouldn't be having pain. You shouldn't be having heavy periods. So being able to know what's normal for yourself and then what's not is going to help inform what you then do about it. So the next situation is, after you know what's normal and then you're able to identify what might be wrong, the next question is what happens, let's assess the risk, right? What happens if I do nothing? Because that is what many of us do. And I want to address how I have seen as a clinician how these sorts of things are addressed, or different ways, perspectives on how to handle them. I'm going to zoom in again. So there is this idea that you can either push through, right, which so many do. I'm going to talk about each of these independently, or that you could just ignore it. And I have been guilty of that as well, so you are not alone here. You might be the person who goes to their yearly doctor visits, right, or their doctor surfing, right? You go to your yearly visits and they're like, everything's great, but you know that you're not feeling your best. So you start seeing different specialists and subspecialists, and still, maybe at that point you've been prescribed a pill for every ill, right? So you've got a medication for diabetes, you've got a medication for fatigue, you've got a medication for sleep and anxiety, you've got a medication for all of these things, right? This is one way of handling it, but it's probably not the best. Then another way of looking at it is just sort of acceptance, right? Like, this is just the way things are. I'm just getting older. There's really nothing I can do about it. There's this sense of helplessness. Or there's a sense of like doubling down, right? That's the person who is like, listen, I only live once, right? And I'm just going to have to live it to the fullest. That's the person who's like, listen, I know that smoking can cause cancer, but I'm just going to smoke these last cigarettes until I can't breathe anymore. That's also an approach, right? But the approach that I would encourage you to use as the CEO is to get to the root cause. And that is exactly what we're going to talk about in just a moment. So let's talk a little bit about each of those scenarios that I've just pointed out, right? So the first scenario that we talked about was this idea of either ignoring it or just sort of pushing through. And I have to talk about this because it's I think a huge issue, particularly for women of color, and Black women in particular. I know that when I was growing up, what I saw were a lot of strong Black women, and who were told to be it all, do it all, have it all, right? So we're supposed to be the freedom fighter, the wife, the cook, the beauty, the educated, the first. We're doing all the things, right? And the affectionate term that I hear being used now is like high functioning. Like, I'm a high functioning woman, right? I'm doing it all. I have it all. And the problem that I would like us to assess is what happens to the strong Black woman or the strong woman when all doesn't actually include you, your health, and your well-being. And this is really, I'd like to help reframe this thought for a moment, this idea of, doing it all or having it all or being high functioning. I don't know that it's really high functioning if you're falling apart on the inside, right? So, any CEO of the company, if your company is running itself into the ground, right? It may look good, the stocks might be up, but it's eventually going to crash. And this is the thing that we are seeing as we're looking at health disparities, particularly for women of color. And why I do the work that I do is because I do see, even for myself and those that I love, working themselves to the bone, but I've also seen the consequence of that, right? So we have the highest rate of obesity and overweight. 60% more likely to be diagnosed with diabetes, 60% more likely to have high blood pressure. We're more likely to die from cancers, from diabetes, from heart disease, from strokes. We have higher infant mortality rates, right? So, this idea of being it all, doing it all, having it all without actually taking care of ourselves, right? This idea of either pushing through or ignoring what's going on in our bodies just isn't going to fly. Not anymore. So then the other option was this idea of, this is the disease based model where you're going to your doctor. And I'm not saying don't go to your doctor, I'm just saying go with a CEO mentality, right? Let them know who is the expert on your body. But this idea that you're going to the doctor, you're waiting for a diagnosis, you're waiting for a disease to be named and diagnosed. And then, the only solution that's provided to you is a pill or a surgery, right? So I'm not saying there's definitely a place for conventional medicine. I practice conventional medicine. I really practice integrative medicine where I really try to merge the two of integrative or functional medicine and conventional medicine. And I do prescribe prescriptions and I do send people for surgeries. I'm not saying that these aren't useful tools, but they're just one of the tools. And what's really important is also to recognize that health is not just the absence of disease. Health is really about the freedom that you have to be able to do, go, and be the person you want to be. And you can't do that when you're not feeling your best. Health is feeling like you have control over the way that you feel, right? That you are feeling your best even as you get older. And this is what the goal should be when we talk about healthcare. And so this is one of my favorite images. I don't want to spend too much time on it, but I will just sort of give you an introduction to it. This is this idea of, what all of these ways of functioning or considering health and disease can look like. So if you look at this sort of green line here, what it actually is showing you is that if you were at your optimal health when you were in your teens and 20s, so if you look at this x-axis, this is age, and if you're looking at the y, it's health. So you're at the highest health, let's just say, in your teens or your 20s, and then over time, your health just starts to slowly decline, right? And this is sort of that YOLO approach or that acceptance approach. Like life is happening, we kind of are in that falsity where it's like this is just a normal part of aging, right? The blue line is this idea maybe of the person who is going to see their doctor every once in a while or on a regular basis, and they're getting their prescriptions, they're getting their surgery, and so their health is good at one point and then it drops. And then you might take a pill or medication and it comes back up, but it doesn't come back up to optimal health. It's, subpar, but you feel okay. And then it drops again. And then you get your treatment and then it drops again. And so you're just sort of on this roller coaster. The top line or the purple line is where I want all of us to be, which is sort of in this idea of ideal health, right? So we are living our lives healthy for as long as possible. And then we, hopefully get hit by a bus and die at the age of 120. And it happens instantly, or we just don't wake up in the morning. But up until that point, we are living a full functional life. We are able to be with our grandchildren. We are able to travel. We are able to see. We have all of our extremities or whatever is happening and that we would quantify as being healthy, that we have that level of health up until the end. And so these are our options, right? So to be able to sorry, go back. The difference between this green line and the purple line is lifestyle. And that's where I focus on. I focus on the modifiable things that we can do to improve our health trajectory. So, what are these factors that influence our health? What are these lifestyle factors that I am so talking about to be so powerful? So, this is my next favorite slide. It is um, this tree represents what you can actually see, right? So if you're looking at a tree, you can see the leaves. The leaves are the manifestations, right, of what's happening underneath the soil. And so if the tree leaves or the fruit that the tree bears is diseased, right, with a diagnosis or a symptom, right, these are just the manifestations, but it actually doesn't tell you why, right? None of these names, cancer doesn't tell you why you got cancer. Arthritis doesn't tell you why you got arthritis, right? The why is actually in the roots, right? And so when I talk about root cause medicine, I'm talking about the factors that you can influence that influence the manifestation of what we see, right? And those root causes are plentiful, and they are things that we can actually influence. So inflammation, stress, diet, trauma, hormone imbalances, genetics. Yes, genetics, we can influence our genetics, and it's important that we understand how we do that. And we do that through all of these factors that I'm describing here. So we're going to walk through each of these in the next couple of minutes. So, and talk about our strategy. What do we actually do about it? And this is where I want you to get your pen and paper. And as we go through each of these strategies, I want you to think about the things that you already are doing that you could just enhance, right? Because health is a lifestyle, and it's things that we're gonna have a lifestyle one way or the other. The question is, are we going to live a life that is going to support our health, or are we going to live one that puts us on the downward trajectory? So we're going to look at all of these factors. And so my approach to health, I call it affectionately the people's life prescriptions, because I prescribe health. That is my claim to fame. And I do that by looking at the factors that you can affect. So we look at the food, we look at nutrition, we look at fitness, we look at sleep, we look at resiliency or stress, we look at toxins or detoxification, we look at your intention in your personal life, your ability or your connection to those around you, connection with yourself. So there's so many things that we can actually influence. And the way that I like to think about this is that if you were to think about it as like a Jeopardy board, right? And you were to take all of these life prescriptions, these lifestyle prescriptions, and you fill in that Jeopardy board with the things that you know that you can do that resonate with you, that would enhance your health. So you have options, right? And you just have to choose the ones that resonate for you. Some of them are going to have bigger impacts than others, but you get to build on this because it is a lifestyle. You get to build on it over your lifetime. And so I want you to write on a sheet of paper, if you can, the personal life, food life, fit life, resilient life, detox life, sleep life, connected life, gut life. I want you to write all of these down because I want you to fill them out as we go through each of these areas. So personal life is about what you believe, right? What you say to yourself, how do you feel, what you forgive, and what you see. This is really important because your mind controls so much of your behavior. And if you have not taken the time to really figure out where your values stand, what your intention is, what you're trying to achieve with your health as it pertains to your goals for your life, then you're not going to make decisions to help you get there because you don't know where you're going. So personal life is really about sitting down, journaling, doing affirmations, building, giving energy and thought to what your intentions are. Okay, forgiving, seeing, being able to visualize your future. So I want you to think about the things that you can do that help enhance the way you think about your health, so that it really has an impact on what you do about your health. The next one is hormone life, right? So really understanding your own body, right? I said paying attention, understanding what's happening from month to month, really tracking yourself for a good 3 to 6 months and finding out how your cycle affects you. And even if you are postmenopausal or you surgically menopaused or don't have a uterus or any of those things, it's important that you understand what's happening from day to day, month to month. And you can actually chart this. And then understanding the impact of what you're doing on your hormones, right? So understanding what prescriptions you might be taking, birth control pills or medications, how these things affect your hormones. And then also understanding where hormone replacement falls into that. Now, that gets a little bit more tricky because for the most part, you do need a clinician to help guide you along that. But start to do your own research and find out, if there is, and talk to your doctors, right, about what your options are. And Food Life, again, there's so much information about what the perfect diet is, but honestly, the perfect diet is the one that makes you feel the best, right? But also the one that nourishes you. And so, really starting to think about food in a way that it is thinking about whether or not you're getting the nourishment you need. And these are just some simple tasks or steps you can take. Limiting processed food, eating more veggies, choosing organic, um, choosing high quality food over quantity, right? I want you to focus on the quality, not the quantity. And you want to eat a diverse amount of food in many different colors. So they're just thinking about food as nutrition as opposed to just calories or just something that you don't think about at all. And then really prioritizing sleep. So, really understanding how sleep affects your health and making it a priority, setting a routine around sleep. A lot of people, particularly when it comes to behaviors around lifestyle, food, sleep, we just let these things happen and we aren't actually being intentional about them. And so I really encourage you to say, okay, listen, I'm going to focus on getting 7 hours of sleep. I'm going to prioritize that and I'm going to create a space to be able to handle that. And then also understanding when things change because menopause will, for many people, change their sleep habits. And so understanding not just menopause, but perimenopause, that phase before menopause that can actually affect your sleep. Um, and so, if you're not prioritizing your sleep, maybe this is an area that you really should focus on, maybe even more important than everything else I've mentioned. And then, resilient life, I find this to be very interesting because stress is a huge impact. And I really feel like so many women understand that stress impacts their health, but they also don't understand that they have control, a lot more control than they might think. And when they're feeling stressed and not having a strategy to deal with it is not a solution. That would be down on the ignore, you know, strategy, right? Ignore it or push through. And that's what so many women are doing. And that is what's leading to our health disparities. So, being able to have a strategy, whether that's a daily gratitude, whether that is developing breathing techniques or meditation, if it's therapy, but we have to do something to build our resiliency so that we can deal with the stress around us because the stress is going to deal with us one way or the other. Either we're going to deal with it or it's going to deal with us. And then detoxification is also another very, very important part that gets overlooked so much. So, are we thinking about the toxins that we're being exposed to in our food, in our beauty products? Are we having a bowel movement every day? I mean, these are really things that a lot of us ignore, right? Like people who tell me they have a bowel movement every 3 days or even worse, once a week, right? So, really being able to say, okay, this actually affects my health. It's not just uncomfortable, it is actually a long term strategy for improving the way I feel, look, and age. And lastly, health is communal, and that's about, that's community, that's between your relationship with other people. There's a ton of research on this area, and I wish I had time to go through it, but it's really important that we think about the people we surround ourselves with and whether or not they're promoting health or whether or not they're detracting from our own health. And if that's the case, we have to be able to recognize that and make decisions accordingly. So, this is why I have created the um, platform that I have because I really do believe that when Black women heal themselves, they heal each other. And when we work in community to do so, that is super powerful. And because of that, I want to share with you more about the program that I created, which is a communal program, it's a group program that helps us dive deeper into these root causes and understand how we can actually influence them, how we can fill out that Jeopardy board in a way that supports our overall health. And so this program is called the Black Women's Guide to Health, Hormones, and Longevity. Obviously, the content in this program is open to all women, but it is specifically for Black women, or targeted towards Black women, because of the health disparities that I described earlier, and also because I feel like this information is really important to specifically talk about our issues. And a lot of other cultures, I know I've had women from Indian descent, or other Hispanic descent, who also experience this pressure of be it all, do it all, have it all, and can relate to some of the health disparities that we experience of women of color. And so, again, it's affectionately called the Black Women's Guide, but it is open to all women who feel like they can relate. And so, I'm going to talk a little bit quickly in the last few minutes here about some of the impact of this program. There's a much longer, or not longer, but another review of the program if you want more details. But I'll give you the website for that in just a moment. But this is one of my patients, Ty, and she says, I can honestly say after 4.5 weeks in Dr. Peoples' program, I feel like I did when I was 30. My body hasn't felt this good in over a year. And you can see her weight results, or her pictures, and I show these, one, because so many of us are working and have been working hard to lose weight, and this program really does help with that. But it doesn't just help with the weight. It really helps with the way that we feel. It helps with our symptoms, and so much more. But I think the pictures also speak 1,000 words, or worth 1,000 words, sorry. So this program includes an online course where we talk about all of the People's Life prescriptions. We go through them in depth. There's direct messaging with me, so it allows you to have constant contact, be able to answer your questions in real time. You have one-on-one coaching with the health coach, so that the program can be specialized or tailored towards you. There's a program manual, so if you're a person who's like, hey, I just kind of want to do it on my own, all of the information is in that manual as well, along with the course. But then we also have live weekly question and answer. This allows you to get the support, because for you to make sustainable changes, it's important that we work through some of the barriers for you to be able to ask your questions, to be able to build upon your own knowledge, for you to be able to share your own experiences. So that's what happens in the group sessions. And then there's also the closed Facebook group, which allows us to communicate on a regular basis, post our pictures, to post our recipes, and all of these things. So there's a lot packed into this program that happens over 10 weeks. I wanted to share another testimonial. I feel great. I honestly didn't realize how bloated I was. I've lost 20 pounds, no bloating. My hair is thicker. My skin is clearer. Dr. Peoples explained why for everything, which was helpful to encourage and motivate me and explain to my loved ones. So again, in this program, you're not just going to learn some, what to eat. We're going to really dig deep into all of the things that we talked about, and at the same time, give you the tools to be able to carry this out through your lifestyle, moving forward. So I leave you with this. Isn't it about time we took care of ourselves, right? Isn't it about time you took care of you? And when you become the CEO of your health and your hormones, that is when you are fully able to take care of yourself and become everything that you want to be, to have that health freedom that you deserve, that we all deserve. So with that being said, I'm so grateful for you guys staying and participating in this masterclass. I really encourage you to get more information about the program. It's called the Black Women's Guide, and it is, you can go to it at www.blkwomensguide.com, and I will send all of this information to you guys. It'll also be available to you on Facebook. So if you haven't taken the chance to check out the website, which goes through the program in much more detail, please do. And if you'd like to make a discovery call with me, you can schedule that from the website, www.blkwomensguide.com. And I look forward to speaking with you guys in the future about your health, your hormones, and your longevity.